For the last 25 years, and quite a few when I was in the White House, I spent a lot of time working with incredibly gifted and dedicated people, trying to help people stay alive with HIV and AIDS and trying to help kill the epidemic itself. Thanks to the efforts of the Clinton Health Access Initiative, 80% of the people in non-wealthy countries who are living with HIV on treatment got medications that we negotiated the price for. Of all the things I've been able to do as a former president, I don't think that anything has made me more grateful than the opportunity to be part of a global network that saves lives and basically makes what we have go further. Yet for all the advances last year, there were still 1.3 million new cases of HIV. To make matters worse, the recent wave of donor withdrawal, especially with the U.S. in the forefront, could lead to more than 6 million additional cases and more than 4 million additional deaths. That's the problem. But we're here at CGI, so let's talk about the solution. Today, I'm proud to be here with all these people to announce yet another life-saving partnership between CHI, Unitaid, WITS RHI, and Dr. Reddy's Laboratories. This is the next big breakthrough. Lenacapavir is a revolutionary, twice-yearly injection developed by Gilead that is exceptionally effective in preventing AIDS, HIV. One shot, 6 months of protection. The group that has negotiated a high-quality generic version of the shot has made it possible for Gilead's sharing of their formula with generic companies to make these doses available for $40 per person per year in 20 countries. And that's roughly the cost of the current PrEP pills that are taken every day for those who have found it to be quite effective in warding off becoming infected. The preliminary tests indicate that this new twice-a-year injection may be even more effective, and it certainly will be easier for people to deal with, not having to do it every day, but doing it twice a year. And it's a massive decrease from the $28,000 cost of lenacapavir in high-income countries. And I think we owe Gilead a real debt of thanks for moving so quickly on these licensing agreements. The generic versions will be available in low and middle income countries just 1 year after lenacapavir hits the market. For the first time, we have a real shot at moving from managing HIV/AIDS to actually ending it. So, for all of you who've had anything to do with this, I'm very grateful. Now, I'd be honored if Dr. Timmy Tope Ilari would share the impact this agreement is going to have in Nigeria. And then we have other who will have things to say. The This is great.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Your Excellencies, former President Clinton, Ministers for Health, distinguished ladies and gentlemen, it is indeed a rare honor for me to join you on this very historic day. Today marks a milestone in our fight against HIV globally. Through this landmark access agreement, we are unlocking affordable access to lenacapavir, a transformational new HIV prevention option that offers longer protection, greater convenience, and renewed hope to millions at risk. This agreement ensures that through this breakthrough innovation, it doesn't just stay with a privileged few, but rather it pairs innovation with equity, laying the foundation for broad, long-lasting impact for those that need it most. The government of Nigeria is determined to expand access to effective prevention and to strengthen our health systems to accelerate progress towards ending HIV as a public health threat. We are going to do this by leveraging on strong and innovative public and private sector partnership. Together with partners, many of you are in this room, we are taking this bold step towards ensuring a healthier and more resilient future, and lenacapavir surely is the key tool in that fight. Thank you.
Thank you. President Clinton, you said it, but you said something we have in common, because it has been 20 years that we are doing access to medicine together, CHI and UNITED. So thank you for the team of CHI, UNITED, and Dr. Reddy to have that very good outcome. It's an historic day. At UNITED, we believe that without an affordable product, then the promising innovation cannot reach their potential and impact. In this particular thing is how to prevent HIV among the women in Africa, which we know it's 100% effective. Three figures I want you to have in mind: the $40, of course, a year. The fact that we invested 50 million to shape and introduce the market together with CHI and WEEDS. It's not only the price, it's also the work that we need to do with the countries, South Africa, Zambia, Uganda, and others, to make sure that we can reach the population in need. And the last thing is, well, 2 years, because since the approval by the FDA, I think that we will have access to generic version within 2 years, which is a record time. The counterfactual is, if we don't do that, in fact, it can take 10 or 12 years. So thank you for the work, thank you for the partnership. And now, let's do the real work with the countries. Thank you.
Well, President Clinton said it best. Today, we broke one of the biggest barriers to ending HIV as a public health threat forever. Lenacapavir is truly a revolutionary shot, nearly 100% effective at preventing HIV infections. But here's what we all know from decades in global health. Breakthrough science means nothing unless the people who actually need it can afford it. Today, this group of folks and many others change that. In partnership with UNITAID, WITS RHI, and CHI, we sat down with Dr. Reddy's lab and locked in this $40 per year price point, the same as daily pills, but for a far superior product. The landmark agreement really has been the result of long-standing partnership between UNITAID and CHI, Dr. Reddy's bold commitment, and Gilead's rapid licensing. This is more than just a deal. It's a game changer in ending the HIV epidemic. It's also proof that we can move from scientific discovery to global impact at the speed that this crisis demands. And I think importantly for this moment in global health, it's a blueprint for how we can move faster and do better to make sure that no one dies from a preventable condition.
Well, we're just incredibly proud to be a very kind of small part of this catalytic work. I do want to thank everyone who is standing kind of with and behind the people on the stage, certainly the extraordinary scientists, the phenomenal people at Unitaid who turn every no into a yes for what is possible. All of the health ministers who will tell us what we need to do to ensure that these remarkable preventative drugs are able to reach the people most in need, particularly girls and young women who represent 2/3 of the new infections in sub-Saharan Africa. None of this would have been possible without all of the people on the stage and many in the audience. We're also not going to stop here. One of the things I most admire about my parents is treating every success as just a challenge, an opportunity, an invitation, and an expectation to do even more. So we're not stopping here, but we do want to pause for a moment and feel enormous pride in what we've done to lower the costs, to begin to plan for increased access, and hopefully to invite even more partners into this work with us. Please give everyone on the stage and everyone they represent just an enormous round of applause. Thank you.
Give them a hand. This is a big deal. And for those of us who have negotiated with all these drug issues over the years, and also on other pharmaceutical areas, it's almost unheard of. I checked, I can only find one other new medicine that has ever been brought to market this quick in a generic form. And we owe a thanks to Gilead, too, for being willing to identify these partners and then to get the show on the road. So we should appreciate that. There are some cases in America where it's taken as long as 30 years to get a generic version of a new drug. And so I don't know what's going to happen, but I know this is a good drug. I know it's remarkably effective. And what all the rest of you should be aware of is we have to do something because of the cutbacks in funding that we hadn't planned on for the last couple of years when we've all been sitting around waiting for this to happen, which is in order for us to get virtual herd immunity here, we not only have to get the new medicine out and get people in high-risk areas to take this twice a year. We also have to take care of the people who were still on medicine, who live in areas that will be adversely affected because of countries that cut back aid. So I've been thinking about that. Chai, we've been working on it, but this is a big deal. You should all be really happy about this. And lenacapavir is easy to remember. Sounds like you just got a compelling new aid in your office. And you did. Thank you.